Well, I was going to open this by asking how many of you had seen one of the puppies in the yellow jackets around campus, but the answer is all of you, because there's one here today. So I'm going to talk to you a little bit about what these dogs are doing on campus and what their sort of future role is going to be. So puppies like Lucy and Maggie and Lola and their buddies there will eventually become assistance dogs, so they're more than just pretty faces. Now, the classic example of an assistance dog is the guide dog. But there are other types of assistance dogs as well, like autism assistance dogs and epilepsy alert dogs, and also psychiatric assistance dogs. So in this 4-year project that's being funded by the Department of Veterans Affairs, we're working with our partners at Centre for Service and Therapy Dogs Australia, or CSTDA, to train up these puppies to become assistance dogs for veterans. Now, the reason why they're on campus is because students and staff at La Trobe University have volunteered their time to raise the puppy for the first year of its life until it's ready to go to its veteran. And because they have the legal right to go just about anywhere, that's why you see them on campus. So they will be going to 20 veterans with post-traumatic stress disorder, or PTSD. So what's PTSD and why do we care about it? Well, it's a response to a trauma. And some of the symptoms include reliving the event through flashbacks and nightmares and things, but also avoiding the things that remind you of the event. And these things can be very common, these sorts of triggers. So it can be something even as common as like the smell of petrol. And so it can be very isolating when people feel like they have to avoid those kinds of triggers at all costs. They might end up just staying in their house all the time. And PTSD is estimated to affect about 20% of veterans. So that's the bad news. The even worse news is that the suicide rates for veterans are about twice that of the rest of the population. And the existing treatments for PTSD, the evidence-based treatments to date, are only effective for probably about half of people who seek treatment. So there are a lot of people who seek treatment and just don't even respond. So that's why we need to consider other ways to support this population, like assistance dogs. Now, the previous research that's been done on assistance dogs has been positive. So people report really profound impacts like increased independence, increased social interactions within their community. Some people who couldn't work before are able to work again. Some people who spend a lot of time in hospital spend less time in hospital. So these are really, really important impacts for people with disability. So if that's the case, then why do we need more research? Why don't we just give an assistance dog to everybody who needs one? Well, unfortunately, the research base also has a lot of limitations. So you get really, really tiny samples, like less than 5 sometimes, or the measures that are used are unfortunately sort of inherently biased to giving positive results. And this has implications for things like government funding for assistance dogs or any sort of disability support. The government wants proof. They want evidence, really firm scientific evidence, rather than just people saying that it's helped them a lot. So that's kind of what we want to do with the veterans with PTSD. We're collecting data on 20 veterans over a long period of time. So we're going to be getting information from them before they start the program or before they receive their assistance dog, immediately after they receive their assistance dog, and then on the long term for up to 2 years after that point. And we'll be looking at things like PTSD symptoms, as well as quality of life, and whether the people who are closest to the veterans are also perceiving some sort of benefit, so a care or burden sort of impact. And we're hoping that if we see the improvements that we're expecting, we're hoping that that will encourage governments to provide more funding for assistance animals so that we can help more vulnerable people.